COVID-19 cases are surging right now because of the Omicron variant. In today's Your Healthy Family, I'm talking to nurses working at NCH Healthcare System about the lessons learned from the Delta variant surge last year and how it prepared them for another wave of COVID-19.
It's been like a never-ending journey with no end in sight, dealing with all these acutely sick patients.
Julie Murphy, a charge nurse, is one of the many staff members with NCH Healthcare System keeping severely sick COVID-19 patients alive during this pandemic.
It's just amazing what we can do for these patients now.
The first case to now, it's a tremendous change.
Ronald Pierre has been a registered nurse at NCH for more than 6 years, but the last two battling this COVID-19 pandemic have been the hardest.
What has it been like to be someone on the front lines of all of this and to see all of this firsthand?
Well, initially, it was a little bit heavy on all of us. But as we go into the pandemic, we have each other back, so we comfort each other.
Maria Kessler, the director of critical care and cardiovascular ICU at NCH, told me the same thing. She says what they all learned from the initial onset of the virus in 2020 had them prepared for Delta.
We were already ahead of the game in a way that we already have developed protocols to take care of our COVID patients. There was a time when I had 47 ICU patients at North Naples, and we had 32 to 35 patients here downtown.
She says the spike in patients was really challenging for the nursing staff at NCH.
We never used travel nurses in the past, and we had to get supplemental staffing with travel nurses to meet the needs and the volume of our patient load.
One of those travel nurses,
I actually came in August with the surge,
is Michelle Mosier. Wherever COVID-19 peaks, she runs right into the trenches.
Initially, I was in New York City when COVID hit back in April of 2020. And then a short time after that, I was at home, and then for a short period from New York City, and I went to Texas. It's a calling. Being able to help people is the greatest thing in the world.
She says looking back from the start of this pandemic to now,
we went from saving less than 10% of lives a year and a half ago to more than 80% now, or even 90% now.
While they're able to save more patients, Kessler says she and the others working to save lives.
We took care of all our patients.
Will always feel the toll of this pandemic and remember the lives lost.
The best way we can. We have lost a lot of patients because they didn't want to be vaccinated. They were all young with families. That could have been prevented.
Of course, a big thank you to everyone who's been on the front lines during this pandemic. Now, all of the nurses I talked to say to get vaccinated if you haven't already, and if you start feeling COVID-19 symptoms, get tested. Early intervention is key. Waiting too long could land you in the hospital. With today's Your Healthy Family, I'm Lisa Greenberg, and for more health stories, head to fox4now.com/yourhealthyfamily.